Recent advances in research have changed the metastatic urothelial carcinoma landscape. How can we maintain the momentum? Urothelial carcinoma, UC, also known as transitional cell carcinoma, is a cancer of the urethrium that lines the lower part of the kidneys, the renal pelvises, the ureters, the bladder, and the proximal urethra. More than 90% of urothelial cancers originate in the bladder. In Singapore, bladder cancer is the 10th most common cancer in men and the 16th most common overall. There were an estimated 401 new cases of bladder cancer in Singapore in 2020. There is a huge global burden of bladder cancer. Globally, there was an estimated 570,000 new cases and 210,000 deaths in 2020. Incidence and mortality is an estimated 4 times greater in men than in women. Often, patients with locally advanced or metastatic urothelial carcinoma have poor prognosis. The 4 most common metastatic sites in bladder cancer are the lymph nodes, the liver, the lungs, and the bone. And 6% of patients survive up to 5 years from the time of metastatic diagnosis. Current approaches to managing locally advanced or metastatic urothelial carcinoma. Today, platinum-based chemotherapy, or PD-L1 pathway inhibition, are preferred approaches recommended by the NCCN guidelines for frontline locally advanced or metastatic urothelial carcinoma. In clinical trials of patients with locally advanced or metastatic urothelial carcinoma, objective response rates with PD-L1 pathway inhibition post-platinum therapy have been shown to be 15% to 21.1%. In a phase 2 trial of 30 patients previously treated with platinum-based chemotherapy, the response rate with docetaxel was 13%.